Member for East Sepik Province.
Thank you, Deputy Speaker. Long you giving me this time long. Asking one question in Noga talk sabe. This last scheme by go long Minister long health. Again related long all this system issues you me looking long. Failure long drug na other medical supplies you go long all PHAs. Mr. Deputy Speaker, given that our population numbers are now quite low based on the census, and our GDP numbers have been inflated, by 2027 we will, and as a result we are now classed as a middle income nation. This means that by 2027 the Global Fund will no longer pay for 70% of our medicines. This means that 70% gap where now Global Fund will pay me, the PNG government has to pay for that. Therefore, it is important that we fix our procurement for the supply of medicines for our people. We can't afford to have situations that have been going on for the last 2 years, Mr. Deputy Speaker, where medicine is sought, now consumables is sought. Now, plan the pressure go on all doctor, now all medical workers law, halivim all sick man law by Marasi. Now, among the many recommendations that came from the PAC inquiry led by the St. John a couple of years back, one of them was to replace the medical procurement and supplies branch, to replace the people in that branch with new people, so that we could avoid some of the problems that we experienced back then. I also checked, the current companies. Most of us here, you may know Sawe good, you may know understand him good. Who are these companies that are involved in medical procurement? I used to always think that it was just Borneo Pacific, so I went and had a look. And I was surprised to find out that 70% of the medicines that we are currently being provided actually come from 3 companies that are owned by the same person, and it's not Borneo Pacific. So 2 of these companies were registered in 2016 and 2017 respectively, so they are new companies. Now, I don't have him name long, and you can check him record them start long IPA. But all got this name and look at some all India or line come or that part of the world. So, lo respect him all, me don't have him, but question blomi also. All question blomi also, me go long minister. Number 1, how many of the PAC inquiry recommendations have been actioned so far, including particularly the replacement of this line ways are involved long procurement here. Has that been done? Number 2 question. Given that the medicine shortage crisis, now you may face him long, can the minister inform this house and our people if tenders were sent out as per the Public Finance Management Act requirements? Or suppose no God, how was procurement done? Was it done via purchase orders? And number 2 question. Number 3, if tenders were properly awarded, why were those contracts not supplied? And we are facing this crisis now. Number 4, given that we are dealing with public funds, there's la money no blomibla, and taxpayers blomibla. Can the minister table a list of all of these medical suppliers and their current contract value, so that the taxpayers, the hard-working taxpayers of Papua New Guinea, can know who is getting their money and for what purpose? Number 5, can the minister also give an undertaking to this house and to the people of this country that in future we will reduce the risk by not awarding more than 50% of all of these contracts to just one company or subsidiaries of the same company? Now, I might add, we are seeing a similar cartel of people who are applying for contracts under the Connect PNG as well. And more same line, that's only got different company name, 5 plus 6 only go now only. Passing talk now only go now put him tender. So you may need law look somewhere good na straight him. so that we are not held to ransom when one company picks up too many contracts and they are not able to meet those contracts and our people suffer. Mr. Speaker, our people deserve better. They are hearing of record budgets every year. This government needs to make sure that they feel the benefit of those record budgets. Thank you, Mr. Deputy Speaker.
The Honourable Minister for Health.
Thank you very much, the Deputy Speaker. Thank you to the Governor for East Sepik for these very, very important questions. Yes, we're fully aware that the Global Fund at the moment will reduce the kind of support to our government because of the middle income status that we have. 70% of the funding that they normally support our government will now be reduced. We are fully aware of that, and we fully working with them, our government, to make sure that we will support. We're working with the Global Fund and other partners to make sure that we meet the gap on what we need to do as a government. The questions with regard to the medical supplies. Firstly, I was going to respond to Parliament last session with regard to the 5 recommendations that were done. 5 recommendations from Public Accounts Committee. I've been instructed, I was not given the chance to respond to Parliament last session, so that particular information will be on the media on what we have done as the department to see to implement the 5 recommendations that was given to us by PAC back in 2018-2019. So the copy of that will be given to the Public Accounts Committee Chairman. At the same time, it will be on the media on what the department has done. That's regarding the 15 recommendations from PAC. With regard to people or companies who are engaged by the department to undertake different procurement or different tendering with regard to medical supplies, Mr. Deputy Speaker, I'm the process where department they make him. It is their own process that I'm not really privy on what the different contractors who engaged by the department. Only got process only. But the question I come today, a very, very important question. Maybe again, I can get a media statement on this one and publish all the companies that engaged by the department. Whatever contracts, all going to give him to date. We want to be very, very transparent as much as possible. We can list all the contractors that have been engaged to supply medical supplies, or how many of them are doing the distribution of medical supplies in the country. We can actually, I will make sure that we have that list on the media, so that all the companies are engaged by the department. All that process only to be clear, but they got a procurement committee, he got to line staff making so. But for the sake of this particular question, we can put him up long. Me ask him, Governor, all those questions. Me ask him today. A very important question. We can take him some time long, respond properly through a media statement. Thank you, Deputy Speaker. Thank you.